Okay. I think we're reaching a critical mass, so we can go ahead. Thank you so much, everybody, for joining us today. I'm Fiona Danaher, Chair of the Immigrant Health Coalition at Mass General Hospital and Director of the new Immigrant Health Center here. We're really thrilled today to have the Pre-Health Dreamers here to talk to us about taking the best possible care of our undocumented patients. And I'll let them explain a little bit more about their organization. But I'm really thrilled to introduce Yadira Ortiz, Denise Rojas Marquez, and Lucy Agbu Novodo as our speakers today.
Hello, everybody. Thank you for joining us today for our training, Building Stronger Communities or Building Stronger Connections in the Safe Space for Undocumented Patients. My name is Yadira Ortiz, and I'm the Director of Pre-Health Dreamers. During this presentation, I hope that everyone thinks outside the box and is open to new ideas. We also want to remind you that proper self-care is a revolutionary act for immigrants and that you are vital to helping immigrants as they pursue a healthy lifestyle. I would love if, I know we were introduced, but I don't know if Denise and Lucy, if you can introduce yourselves again really quick.
Hi, everyone. Thank you so much. I'm so excited to be here and just, really share our thoughts. I'm currently a fourth-year medical student at Mount Sinai, New York City. I recently finished my MPP degree at the Kennedy School in May, and I'm also co-founder of Pre-Health Dreamers. And, we started in 2012.
Hi everyone, my name is Lucy Agbu I am a third-year psychiatry resident here at the MGH McLean program, and I'm just honored to be here to join the Pre-Health Dreamers for this presentation and training. They have a wonderful organization, and anything I can do to help support and amplify their voice, I'm greatly honored to be a part of. Thank you all for joining us.
Thank you again to everybody that's here, and thank you to our team for being here today and for presenting this information to everybody who's available for this presentation. Next slide, please. So a little bit about Pre-Health Dreamers. Pre-Health Dreamers has 3 areas of focus. We are a nonprofit and we work both in the state of California and across the country. We have our peer engagement and enrichment program known as PEEP, where we guide, advise, and empower undocumented students pursuing health and science professions. We also create and bring resources to professionals and in the health and educational systems. We advocate for more progressive health and educational policies for undocumented students and the communities as a whole. Next slide, please. For today's training, our mission is to bring awareness about the undocumented community at the national level as well as in the state of Massachusetts. We will also touch on legislative policies that affect healthcare access for undocumented individuals. And we hope that today you leave with concrete ways that you and your professional teams can support, empower, and provide a safe space for your undocumented patients. So who are the individuals without permanent status in the US? DACA is one of the statuses that we're going to be focusing on today, and DACA was announced in 2012, and it has afforded many young adults with new opportunities by providing access to work authorization, a social security number, and reprieve from deportation. The other category that we're going to be talking about is TPS. TPS is a temporary program that allows foreign nationals to remain in the US if something catastrophic happened in their country of origin, preventing their safe return. TPS provides authorization for employment and also to be protected from deportation. And the third category is undocumented. Immigrants who are individuals who lack unlawful status, and they lack lawful status granted by federal authorities, and they do not possess any type of visa, protective status, or work authorization. So now for this presentation and for this training, we're going to continuously refer to all 3 categories as undocumented. The big distinction between the first 2 categories, previous slide again, please. A big distinction between the first two categories is that DACA and TPS recipients do have permission to stay in the country and are authorized to work. But we also want to refer to all three categories as undocumented because number one, DACA and TPS status are not promised, and these individuals are in risk of having their employment authorization taken away. So especially with DACA, they have to continuously be renewing, and it's not always promised. And with legislation, that's also a fear within the community. Number two, individuals in all three statuses may have similar needs as it relates to healthcare. Next slide, please. Want to give a quick overview of what the population looks like for individuals without permanent status in the US. It is estimated that there were 10.5 million undocumented immigrants residing in the US in 2017. That makes up 3% of the total US population. Within those 10.5 million, we encompass 600,000 DACA recipients, which is 6% of the population, 411,000 TPS holders, and around 9.4 million undocumented individuals without employment authorization or social security numbers. As you can see, DACA and TPS are a minority of the entire community without permanent immigration status. Next slide, please. I would also like to provide additional information in regards to Massachusetts and the patients you may be currently serving if you're in that area. In 2019, there were 250,000 undocumented immigrants in Massachusetts. The undocumented population in Massachusetts accounts for 22% of undocumented population nationally, which is approximately 1 in 5. Also, 1 in 5 workers in Massachusetts is an immigrant, comprising a vital part of the state's workforce. According to Migration Policy Institute, undocumented-led households in Massachusetts paid an estimated $593.6 million in federal taxes and $252 million in state and local taxes in 2018. Next slide, thank you. We're gonna go ahead and talk about national legislation again. The last immigration reform was the Immigration Reform and Control Act of 1986. This was the first legislative attempt to comprehensively address the issue of authorized immigration. The bill included sanctions against employers for the hiring of undocumented migrants, more robust border enforcement, and an expansive legalization program that was unprecedented. The legislation still affects immigrants today. In the last 20 years, the Federal DREAM Act has failed to pass several times. In 2001, in 2010, in 2017, and in 2019. Other immigration reform bills have also failed to pass at the federal level. A change in political parties does not promise an easier immigration path. Many undocumented members remain undocumented without immigration reform and increasingly restrictive policies under both Democratic and Republican presidencies. And certain immigration statuses such as TPS and DACA are continuously in danger of being discontinued. For countries such as El Salvador, Honduras, Haiti, and Syria, the TPS cancellation dates are set for early 2021. And I'll go ahead and pass it along. Thank you, Denise.
So this slide is talking about national legislation as it relates to healthcare and other federal programs. So access to, for example, healthcare and these federal programs from their inception have left out undocumented immigrants. So it includes the Supplemental Nutrition Assistance Program, or SNAP, the Medicaid, Medicare, cash assistance programs, such as the Supplemental Security Income, Temporary Assistance for Needy Families, and its predecessor, Aid to Families with Dependent Children. However, in 1996, federal laws and immigration laws introduced new restrictions, and these were under President Clinton. So this meant that lawfully residing immigrants, including folks who had recently adjusted their status to permanent resident were barred from receiving assistance under federal benefit programs for at least 5 years. And even where immigrants were eligible for benefits, there was a chilling effect, which you may have heard in the news, has recently been an important point of discussion, is the sort of increasing number of restrictions that then raise a lot of confusion about the laws. So what this happened, in this time period was that there was an increase in uninsurance rates among foreign-born, less educated single women and among children of foreign-born women. And while states have tried to fill some gaps in federal options, their states often face ongoing budget constraints, legal challenges, that have unfortunately failed in certain spaces to really provide the robust services that individuals need and deserve. And I always try to remind myself that these laws are confusing. And I think about, how can we expect community members to know the intricacies of these laws? And it's often much easier just to stay away from the healthcare system altogether. Next slide. So other federal legislation, I think, is relevant for this talk and our conversation. First of all, EMTALA, which I'm sure many of you are very familiar with, which is a Emergency Medical Treatment and Labor Act of 1986. And it requires that anyone coming into an ED is able to be stabilized, treated regardless of insurance status, ability to pay. And this also applies to undocumented persons, but that doesn't mean that the service is free or that the patient won't be billed. So thankfully, under emergency only Medicaid or EMC is available to individuals who are otherwise eligible for Medicaid except for their immigration status. So some states are currently covering testing, treatment, and vaccines for COVID-19 under EMC, but generally cover the specific benefits vary state by state. And then Title VII or Title VI of the Civil Rights Act requires that federally funded facilities provide interpretation services for all patients who request it, though implementation is uneven. And this brings me back to some of my rotations where I would meet Spanish-speaking patients who did not understand what their provider had just explained to them and did not feel comfortable asking for clarification, and they would sort of talk to me in Spanish. And I urge you to empower your patients with the knowledge that if you don't understand your doctor, ask for an interpreter. It is your right. Or si usted no entiende a su doctor, pregunta por un intérprete de español, es su derecho, or whatever language they speak. So many patients are not aware of the law, and there are few mechanisms that are or financing mechanisms to support it. And then lastly, public charge, as I briefly mentioned, many of you have probably heard about it. It is a test that is part of a federal immigration law that is essentially designated to identify people who may be deemed dependent on the government as a main source of support. A series of changes to this test were scheduled to take into effect in October of 2019, last year. And it would have made it really hard for certain immigrants to adjust their immigration status. We won't go into further details in this presentation, but as a result of this rule, a number of studies have found that families are already avoiding public benefits due to concern about these changes. And this is what advocates call the chilling effect. And I'll pass it back to Lucy.
Yes, thank you so much. One thing that, I have always felt in my path in medicine is when you hear about the problems, when you hear about the issues facing our patients, like how do we actually do something? How do we intervene? What can we do to make a difference? And I wanted to kind of frame all of this around the idea of structural competency. This is a framework that has now been, gaining a lot of recent attention in the medical and healthcare world around trying to understand and train healthcare professionals, train those in this work to recognize and analyze and to be able to intervene upon the various different factors, structural factors that impact health disparities, that impact how our patients are able to access equitable care. And we know that these structural factors can be policies, economic systems, like that my colleagues have already described today, and other institutions and ideas and cultural norms that maintain these modern social inequities and differential access to opportunities for many immigrants in our country. And it's really important for us to understand that within structural competency, what I like about it is that it gives us a way that we can start looking at how to do something, how to actually start making a difference versus just talking about what the problems are. We know that with whatever we're trying to do with immigrant population, it's really important for us to always also add the element of cultural humility, which we've all probably have heard of in the past in our training, around the idea of having a self-reflective and self-critique way in how we look at ourselves when we deal with those from different backgrounds, from different cultural backgrounds, and knowing that it's going to be a lifelong learning. It's not going to happen all at once, and knowing that there's going to be differential power imbalances between how our patients can relate to us and how they relate to the systems at large, and factoring all of that into place when we relate with our patients. Next slide, please. When we look at the levels of intervention under structural competency, I love how there's different levels that we can look at. How do we intervene? So for example, at the individual level, those of you who are already here on this call are trying to educate yourselves about these issues, about what the social structures are, understanding how to, learn what can we teach ourselves about what the problems are. That's a level of intervention, and it can hopefully give you some level of empowerment to know that you are doing something in trying to mitigate the issues facing these patients. Interpersonally, how do we address when a patient is in front of us, their determinants of health, sharing power with them, hence that understanding of power, balances. How do we engage in these one-to-one interactions to make a difference in their health outcomes? Looking at the clinical and institutional level, there are going to be more discussions about this in subsequent slides by my colleagues about how we can create and really modify our clinical environments to be more, ally supportive to immigrants, especially those who are undocumented. In the community, partnering up with organizations such as this one, the Pre-Health Dreamers, and others who are doing the work around these issues so that we can actually promote equitable investment in these communities that are actually most affected by these problems. And then research. Many of you may be, aware of certain researches that are being done, but knowing how we actually change the work that's being done in research to be more inclusive of those from different backgrounds, knowing that we do have power dynamics in research, and how do we actually make policies that actually have actionable impact in these communities, and challenging what, the naturalization of inequity in our healthcare system. And policies, right? We've already looked at some of the policies that are already in place and how they're impacting people's lives, but policy, as we know, make a difference. So all these levels of interventions are important for us to be aware of as we think about how do we actually enact change for our undocumented patients. Next slide, please. So part of my work, I'm a psychiatry resident, like I mentioned before, is looking at mental health. And we know that, migration, the process itself by which someone leaves their country to come to a different country to start over is going to have a lot of challenges. And some of those can actually lead to greater impact on their mental health. We know that patients and their families go through quite a lot of traumatic experiences, sometimes leading them to fleeing their country to come to the US. And some of these experiences could be just from trauma, physical, sexual trauma, exposure to violence, being separated from family members. If you can imagine, what this may be like for patients having to go through this, all this can increase their levels of mental health impact. We have lack of social support. As we know, when we are not attached to people that we can feel connected to, that we can feel safe to, when we are fragmented from our communities of support, it can lead to maladaptive behaviors such as substance use, domestic violence. All these things are risk factors for patients who are migrating from different countries, especially those who lack social supports. And as we know, in an increasingly sometimes hostile environment for immigrants, patients can become quite hypervigilant of their surroundings. They can become hypervigilant of just being able to exist and navigate a world in which they feel like they can't even be themselves. They can't even be able to be visible due to fear of negative consequences. And that level of hypervigilance can lead to really negative psychological distress and to bad health outcome. And loss of identity and decreased self-worth. Time and time again, we know that patients who have gone through these really, really traumatic and negative experiences can start losing and having their spirits eroded by the trauma that they have gone through. And that stress can really have some devastating outcomes. And we really need to be aware of what can happen when these risk factors are not understood and potentially acted upon to help support the patients. Next slide, please. So I wanted to just share this schematic that was in this wonderful paper that looked at systematic review of undocumented patients in this country. And it just kind of charted from looking at migration-related stressors from the pre-migration to post-arrival and how all these factors can culminate. We kind of already addressed some of these things, but if you're looking at the pre-migration factors, when you're having to leave your country to go somewhere else, is usually because something really, really impactful has happened that causes that imminent requirement to flee for safety. And sometimes it can be really severe trauma, a sense of failure, a sense of not being able to have to stay where you would want to stay and having to leave. And then when people are traveling to come to the US, we know that the transit period of time can be quite dangerous. You may have heard about the border crossings and all the devastation that can happen, as people come to this country. And then when they get here, there's a lot of factors that can lead to additional stress, having limited resources, fearing deportation, being marginalized and isolated. All these stressors, please go back to all these stressors can lead to feelings of psychological distress. However, we really want to also emphasize that there are wonderful protective factors that immigrants bring in to this country, to their lives, that can actually protect them from some of these negative outcomes, like having a strong, cohesive, community-based social support. All this is really wonderful because it can help anchor them and it can help prevent the levels of distress that we can see sometimes. The resourcefulness, the creativity, the resilience that they bring to their journey, that they bring to their lives, all these things are really wonderful assets that can help support them. Having optimism for the future, empathetic, outlook for others, and reframing the undocumented experience as that in which they're fighting for for change, for betterment of their families, and not one of a negative or pejorative term. All these things are very protective factors that can help. And as we see, these lines are bidirectional because it can go sometimes each way, but we know that the negative mental health outcomes can lead to depression, anxiety, PTSD, substance use and abuse, and other factors. So again, just kind of a way of schematically looking at all the different factors that can culminate to a mental health outcome for our patients. Next slide, please. And when it comes to barriers to actually accessing mental health treatment, this could be barriers accessing any kind of health treatment, not just mental health, physical health as well. We know that immigrants are less likely than US-born individuals to access mental health services, and the reasons are multifaceted. We know that the difficulty in navigating the system, including linguistic barriers, like Denise mentioned earlier, not having access to those who are able to linguistically, explain what's happening and give them fully informed medical knowledge and health literacy can be challenging in navigating what a bureaucratic system that we already have in our healthcare system here. Lack of information and resources, we know that can definitely be a barrier. Stigma towards mental illness, this could be, some part of it could be also cultural, but a lot of it can also be, stigma in how they're approaching the, when they approach our mental health providers, like, how do they feel that they're being supported? That can lead to them having negative stigma around mental illness themselves. Inadequacies of services, this is a much bigger issue across the country, but immigrants are definitely feeling the brunt of it worse, because due to lack of legal access, due to lack of being able to actually, have benefits, they have even more limited amount of options for treatment. Preference for alternative treatment options. People may have their own cultural or spiritual, preferred way of addressing issues that they may not feel comfortable bringing up to mental health providers, and they may want to try that first as an option. Medical mistrust, time and time again, we know in our healthcare system that implicit and explicit bias can lead to negative health outcomes for immigrants and patients of color at large. And that can lead to medical distrust from immigrants towards providers, because they don't know if they can feel safe and vulnerable to really share part of their work, part of their challenges with the providers. And then again, with the current, current administration, what has happened in the last, 4 years, and even prior to that, we know that there's been, increasingly exclusionary immigration policies that can lead to more stress of apprehension and, again, limited access. Next slide, please. So how can we support our immigrants? I think it's really important that we are all, open to patients, seeking support from, non-medical sources and religious spiritual groups, and incorporating that into how we understand their cultural background and their care. When people have a humility and an openness to hear from patients and how they want to be supported, we can go a long way in building therapeutic alliance, encouraging patients to foster connections to their own cultural communities and resources. We know that patients who live and are around those from similar cultural backgrounds that are immigrants actually thrive and have more of a supportive system and can lead to a better health outcome. Involving family, in the shared decision making as patients deem appropriate, it's really important, because a lot of our patients come from very cohesive and collective society in which the family unit is core and less of an individualistic unit that we may see here in the US. And then promoting, great understanding of and compassion of the unique challenges of the immigrants face, what we're all learning here today, why we're all here today. And again, knowing that stronger social identity leads to greater resilience. The more that people are collectively together and supported, the better the outcome is. So isolation is definitely something that we don't want to foster, because having a system of support is really, really important. And all of us just trying to make sure that everyone feels welcome and included, and providing pathways for us to continue doing that. Thank you very much.
Next slide. So we're now, one before. So we're now shifting to look at some more additional ways in terms of how can you, as a practitioner, engage in structural competency for the undocumented community. And we hope that this discussion, while we'll be discussing about a few intervention levels, can at least provide some ideas for you and your healthcare facility where you practice. So first and foremost, we want to acknowledge that we approach this work with the firm belief that healthcare is a human right. It is not a privilege. I repeat, healthcare is a human right rather than a privilege. So with each microaggressions, like having materials in English when someone only speaks in Tagalog, and macroaggression, like the public charge, immigrants can absorb and internalize the experience of exclusion, leaving them ill, frightened, and without access to healthcare. And these exclusionary practices are not only present in healthcare, it is often in every facet of life that a person's immigration status can impact them profoundly. So when someone has an automatic assumption of I am not eligible, this doesn't apply to me, or even I am not deserving, our job as healthcare workers is to find ways to say the opposite from whether our words or actions and in the very structure of our institutions. So also when thinking about structurally competent interventions, I think it can also be really helpful to think about the ways in which individual patients have different needs and varying access to healthcare. And this can be based on immigration status, as we've already alluded to a little bit before. So for instance, a DACA recipient in New York, for instance, myself, is eligible for full scope Medicaid if I met the income requirements. But maybe my family member who is equally deserving of healthcare, may not be. And so, this has really large implications to mixed status families, who may have different eligibility, or I guess have different eligibility based off of their own immigration status. And English proficiency. So in California, one study found that Vietnamese, Cantonese, Mandarin, and Korean immigrants were less likely than Spanish speakers to receive a PAP test in the prior 3 years. So I think this highlights that, the difference between English speaking and non-English speaking isn't the only sort of difference we should look at. What about sub-communities within this immigrant population, and how can we ensure that we're meeting the needs of the various populations. And as we also know, and Lucy talked about, that English proficiency can impact a patient's ability to provide a detailed medical history, understand dispo instructions, and what pharmacy to pick up medications, etc. In terms of residential location, certain states have been able to expand more services and opportunities for immigrants. One example that was just in my news yesterday, that the state of Virginia recently passed a bill for undocumented Virginians to be eligible for driver's licenses. And here in the state of Massachusetts, discussion on driver's licenses for undocumented workers has intensified after the pandemic, which is the news clip that I included. And lastly, stigma and marginalization. For a long time, I was really naive to think that undocumented immigrants were seen as equals in the public eye, that we would all be deserving of immigration reform and protections if the opportunity came. And yet when I came to DC last summer, I sat in meetings hearing that TPS individuals were to blame for their actions, but DACA recipients were blameless. And my eyes and my heart, I had the assumption that we were all the same. And so thinking about those distinctions is really important. Next slide. So this sort of goes through a few examples of ways to be able to be an ally to this community. So as you're already here, learning and educating oneself about the individual immigrants' level of access to various social and health programs at the city, at the state level, and keeping up to date with major changes is really important. And signing on to letters of support for pro-immigrant legislation. For instance, having a letter from your healthcare facility explaining, to your congressperson why, or your legislator why the Massachusetts driver's license bill is important for healthcare facilities, I think people will read that. In terms of interpersonal, in being able to address a patient's fear of coming into contact with ICE, having those one-on-one conversations, explaining that in a healthcare facility, they should feel welcomed and entitled to the healthcare that they deserve. And also having education on HIPAA, that we as healthcare providers know that that is something, we take very seriously, but a lot of patients don't know what that is, and that they don't know that their information is confidential, with some exceptions, of course, if they are presented a threat to them, I guess, harm to themselves or to other people. But really, I think medical information is largely unavailable to others unless folks are self-disclose that information. And I think something really important is to remember not to write undocumented on patient records, as it shouldn't be in the records if it doesn't need to be. And at the community level, being able to partner with organizations such as legal clinics to ensure that patients have access to affordable, low-cost legal help, and discuss with local nonprofits on, what is the community, undocumented community at this moment experiencing? For instance, if volumes are lower in your clinic or in your hospital, is it because of fear due to the public charge or something else, some disconnect, and how can you help bridge that gap? And then lastly, at the institutional level, you can have and encourage language on your website with resources and information for your undocumented patients, and even having discussions with HR. If you have DACA recipients, TPS workers who are working in your facility, how can you sponsor them for a green card, for visas, or in other ways be an ally to healthcare workers. Next slide. So this is a screenshot of Clinica Romero, which is a low-income clinic in Southern California. And I love that, as soon as you open the website, it says in big bold letters, healthcare is a human right. And having, that visible signs of affirmation is so important. As I previously mentioned, when all the time you're getting messages of really the opposite. And this is a quote in WBUR of a physician who said, "I explained that nothing he said here could be legally used against him. Medical centers have long been considered a sanctuary from immigration enforcement, along with schools and places of worship that are where the Department of Homeland Security calls sensitive locations, places where deportation enforcement should generally be avoided." Next slide. And here are some ideas that we have brainstormed into, other ways to have this visible representation. And just a really short anecdote, when I was a student at UC Berkeley, and I remember walking into my professor's office hours, and she was my sociology professor, and my conversation was on a small assignment, and I remember behind her a big logo that said undocumented immigrants can go to college. And I just remember staring at it and thinking, she's an ally, and I could just talk to her and feel safe. I think just that really opens up so many doors. And I think even having something as small as a poster can really make a big difference. So encourage you to, so this is one that we, Yadi made, and will be available for folks. And so just basically, the message should be that immigrants are welcome here, that healthcare is a human right, other signs of allyship, and you can, encourage to make your own logo. And additionally, having resources for the undocumented community in the lobby while folks are waiting, having the materials translated, having clear policies on ICE's present at the hospital. Does security know what to do if ICE is ever to present at the doors? And having a pin or a button, I'll show in the next slide an example of that as well. Next slide. So here are more examples. On the bottom left is a pin that I like to wear on my white coat. It says "Migration is beautiful," and I've had patients ask me about it. And the pin to the top of it says PhD, and something that I wear really, really proudly as well. So on the top left is it's at MGH. It's in a resident conference center, and having kind of those visible signs of allyship, I think, is really, really important as well. And here in the bottom, in the green sort of banner, is the Seek Care Without Fear. So this was the New York City Health and Hospitals website. And this was after, the public charge was introduced. And, I love that they said that federal officials have confirmed that the public charge rule will not be used against anyone for testing, treatment, or prevention of COVID-19. And then in the top are some resources for providers on knowing your own rights and your patient's rights. And we have the link available as well. Next slide.
So now we would like to continue to provide some concrete ways to connect with your patients who come from various cultural backgrounds. And I see a lot of messages coming in. I hope we can touch base on those in a little bit, but we'll continue now with the presentation. And then one thing we want to question is, do you serve patients who are undocumented and uninsured? Does your site serve patients under health access programs? Does your state have a health access coverage similar to Medicare? Do you serve those patients in your clinics or in your hospitals, in your setting? And would you like to better connect with them? I think that's one of the main questions. How do you want to connect, and do you even want to connect? And we really hope and urge for you guys to do so. Some of the ways that you can do this is by taking concrete steps in helping them feel safe under your care. Community healthcare workers, nonprofits are vital in collaboration to make your spaces safer for undocumented individuals. Have them come and present to your team. Find out who those organizations are. Professional development workshops can help increase cultural awareness and knowledge and skills to your staff and community. Have a liaison advocate that works and connects with undocumented immigrant patients and the community as a whole. Make this a goal, whether it's a person or a team or current staff member that can be appointed. You can also think about hiring somebody. Hire a specific advocate or social service specialist that can assist undocumented patients, who can do all of the research, create the resources, and train the rest of the team. Higher advanced students. So right now in Pre-Health Dreamers, we have around 50 students who are undergrads, and then we also have graduate students, around 15, who are very familiar and aware of immigrant and undocumented backgrounds. Look into the schools, look into the different nonprofits and see if there's advanced students and health professionals that have a background and that can come in and work with your staff, or hire them. Students are always looking for fellowships to be able to both get experience but also serve their communities. And I know this is coming across in a lot of different institutions, both in higher education and in healthcare, but diversity and equity and inclusion task force or departments or a specific director are really being developed all across the country. And they can really help to take the steps above into place. If you have one already, ask if they incorporate immigration status as a social determinant of health. Request that they research, provide resources, and create programming that can help your team connect with the undocumented immigrants. One reminder is to please stay away from asking your patients for their story. for their story, or for them to be the ones who bring in this knowledge into your clinic or to your hospital, into your workshops, unless you really do have a strong bond with them. Sometimes we even have students that are presenting. However, you really want to stay away from trying to learn all of this information from your own patients. You want to coordinate with traditional healers in your community who believe in non-traditional medicine, because a lot of undocumented immigrant patients may have those same feelings, especially if they've recently arrived to the United States. It's really important to learn about health coverage and the process for immigrants and share that information, right? So if you're knowledgeable, if you found out new information, how can you relay that to your patients? Info sheets in the waiting rooms, when they sign in, when they're leaving, up in the, post them up in the walls of your either office or again, in the waiting room. Next slide, please. Advocacy is very vital, and there isn't a large focus on teaching this skill to students who are pursuing health professions. If you're a faculty or an educator, include advocacy into your curriculum. At Pre-Health Dreamers, one of the most important areas we focus on is self and community advocacy. Undocumented students must learn this from a young age, and it will also be important for themselves and the communities they will serve as health professionals. If you're an administrator, equip physicians with the right resources so they can address discrimination in the workplace and in the community. Remember that TPS and DACA recipients may be your coworkers. And connect with the community again and learn how to advocate for your patients and connect them with resources that would support a healthy lifestyle. Next slide, please. So now, temperature check. I know we gave you guys all a lot of information. As I'm speaking, I'm seeing comments come in. I'm sorry, I'm seeing them come in, but I'm trying to stay away from reading them because I know that's gonna kind of wanna spark a lot of conversation. But I think right now, are there any comments or chats, Denise and Lucy, that we really wanna kind of right now reflect on or have a little bit of answers for our attendees?
I guess one that I'm looking at right now, it reads, we also need to be aware that not every medical institution currently wishes to make undocumented people feel welcome for financial considerations, folks who don't have health insurance. So I think, I'm also, understand that is the reality. A lot of folks, most institutions are thinking about their payer mix and how to, maximize profits, or at least ensure that, their financial model is sustainable. And, I think about all of the spaces, for instance, in the New York health and hospital system that is open to individuals without immigration status, and is, at least I think, should be accessible to folks. So even in the low cost clinics, in the public healthcare systems, I don't think those are currently adequately representing that sort of robust, visible, welcoming support for that community. And so I guess I'm saying sort of maximize those visible places of support. And then in the places that are, just frankly, I don't, I think if there's a place that's like, I'm going to deport you if you, are undocumented, then, make that visible, saying don't go here, talk to the community-based organizations and say, at this clinic, please tell your community members not to come here. And then, kind of anyone who falls in between, I would say that, I think we have a long way to go. And if it's not, creating this visible sort of signage, I recommend, is there a way to engage in another way, in whether advocacy, co-sponsoring, laws, in, calling legislators, in, empowering folks that, maybe for preventative services, you're not welcome here, but if you're in emergency, an emergency situation, like come here. I mean, I think there are so many variations in level of access, but I would say that the default oftentimes is, you know, I'm not eligible, I don't, you know, deserve this care. So how can you sort of be more inviting in the spaces where, you know, people are ready to help?
Thank you. And I know, like, for a lot of folks there, for a lot of facilities or institutions, sometimes it's very difficult. You know, it's not easy from day to night. Things are going to change. But I think one of the big takeaways is to start those conversations, or even do a self-evaluation. How could I myself, you know, do this and work with patients, and then how can it grow within your institution or within your hospitals? So it is going to, for some, it is going to take a time. But I think what is very, very important is that we start these conversations now, and that we really take part in creating these healthy atmospheres and these safe atmospheres. Because of the sake of time, I'm going to go ahead. If you can please go on to the next slide. So today we are going to actually, we have a link. I'm going to go ahead and put it on the chat. We've created a few, or gathered a few resources for all of you that you can take with you, and hopefully read through them, take ideas from them, and hopefully it's valuable information. In the resources, we've provided information like for mental health, how to help individuals do a family planning or how to bring awareness on that. Also, how to talk to your patients about immigration customs and the safety that there may be or may not be within your facilities. So we have that available for you. Next slide, please. Also in the resource kit, I saw earlier is like, is there anywhere in Massachusetts, any organization? So one of the link, or one of the slides within the links is actually very specific to Massachusetts. So I'm hoping that helps you get started in researching what resources, what organizations are in your area. Again, this is just a starting point. There's gonna hopefully be a lot more out there. And in having those conversations with your colleagues and you start those conversations in the community, your list of resources is gonna grow. So this is, again, just a starting point for all of you. I hope that you're able to open the link. I was giving it a few seconds. So please let me know, thumbs up, thumbs down, if you were able to open it or not. And again, please take the time to read through those and reach out to us if you have any questions. Next slide, please. Thank you. Thank you. I see some thumbs up right now that you were able to open it. That's always, you know, a concern. Are you able to open it once we create these shared documents? And so again, we want to say thank you to everybody who took the time today to sit with us. I know it was a lot of information. Usually these trainings, UndocuAlly trainings, it can be 2 to 3 hours. And we try to just kind of take little snippets of our presentation and bring you hopefully what we thought would be, everything's vital, but we were hoping to really pinpoint what you can really take away from this. But yes, it's a lot longer presentation, so we're sorry we had to encompass it in 45 or 50 minutes. We want to invite all of you to be part of the, next slide, please. We want to invite everybody to become part of the Pre-Health Dreamers Network and family. We do have an event coming up this Saturday. It's a fundraising event. We're in our fundraising month. But more than that, this is really a community building event. We'll have music, art. So if you like it, come. If not, come and use that side of your brain for a little while. Decompress with us this Saturday. Enjoy some poetry from our own students. It's going to be in the 4 p.m. Pacific time. So what is it, 4, 5, 6, 7 o'clock your time if you're in Eastern time. So please join us. This slide is again in that toolkit that we just provided for you, so it should be accessible to you.
Thank you.
Any other thoughts, Lucy, Denise, before we close?
Just want to say thank you to everyone for attending and for being engaged and willing to hear how to support our undocumented patients. And really wonderful to see you all here today.
Yeah, no, just a big thanks for the invitation and for just, hearing just, where hopefully, something inspired you or something, helped, you want to investigate further into what you can do at your institution or at your city or state level. So thank you so much.
Thank you for joining us. This was incredibly comprehensive for 45 minutes, and we're very, very grateful for you to you for condensing it down and sharing it with us. We're also grateful to you for this incredible toolkit and for allowing us to record this presentation, because I think this is phenomenal and we'd love to continue to share it. So with that, I guess we'll draw to a close, but please feel free to share any additional questions. We'll send these resources out